inevitable given the high levels of the circulating virus and that it is difficult to predict a time frame for it. As new variants come out, virus is of course natural as we know, and existing variants will make way for new variants which may or may not be more virulent, but variants should not make any difference in people's primary approach of COVID-19 appropriate behavior. We should be prepared scientifically to take care of that. And as citizens, how should we prepare ourselves to combat this third wave? Let's find out from our experts. Joining us on the program today, Dr. Ashok Chaudhary, Associate Professor, ILBS, New Delhi, and Dr. Arun Sharma, Director, ICMR, NII-RNCD, Jodhpur. Welcome to Rajya Sabha Television, both of you.
Thank you.
And Dr. Sharma, we are unaware of the time scale of the third wave, hopefully incrementally, but we should be prepared for this new wave. Your opening comments, sir.
Definitely. We are in the middle of the second wave, and at this moment, we cannot predict when the second wave is actually going to end. But the way the virus has been behaving and the way we are responding to the virus, it looks very likely that there is going to be a third wave. And we are not going to have very much time to prepare. Like you saw between the first and second wave also, there was not a big interval. Similarly, in present time, from between the second and third wave, we may not get time to recover and face ourselves. So my appeal at the beginning will be that we need to be responsible, we need to be accountable. Every individual citizen must come forward with COVID appropriate behavior, get themselves vaccinated to reduce the impact of the second wave now and the upcoming third wave.
Absolutely. Dr. Chaudhary, what is your take on possibility and the scale of this third wave?
Yeah, the virus is known for its change. So we first thought it is the first, then comes the second, hopefully the third will come. But there is a way, as Dr. Sharma has told, that the third phase is inevitable, but can be preventable. So prevention of third wave can be by the proper COVID appropriate measures, definitely. Large scale, I propose universal vaccinations, and third, implementation of technologies at the current time to curb the transmission and to prevent the massive spread of COVID. The way it is going on, we need a break to this spread of COVID.
So we need a break. Dr. Sharma, how do we break this chain?
Yeah, so that is the most crucial thing for any infectious disease. Breaking the chain is the key. Now, how do you break the chain? We have three kind of devices with us, or three resources. Putting the mask in the right way. And when I say right way, I mean covering the face, including the nose and the mouth properly. I will go into a little detail, not removing or putting your mask down when you are going to talk or when you are going to sneeze or cough or anything. You have to keep it on when you are in a situation. If you are infected, then to prevent transmission from others. And if you are not infected, to prevent yourself from getting infected, this mask usage is very important. Secondly, when you are going to a high risk area where the possibility of getting infection is higher, means suppose you are in a hospital setting or you are close to a patient, we are now recommending that we should be wearing double mask. And one of the masks should be a surgical 3-ply mask and the other mask preferably an N95 mask. So the combination of two in high risk situations will give us a better protection. Besides that, maintaining the distance has become more important and more relevant with the new knowledge and understanding that the virus is now airborne. When it is airborne, we should not confuse or we should not think that the virus is going to multiply the numbers in the air. But what it means is that the virus can remain suspended in the air for a longer time as compared to what earlier we thought was due to droplet infection. So this longer survival and presence of the virus in the air makes it airborne. So again, we have to understand that suppose in a closed, unventilated room, if as an infected person, I am sitting alone with my mask down, and then while simply breathing, I am leaving the virus inside the room. And once I walk out, and if the room is empty and another person walks in and thinks that, okay, this is an empty room, I am safe here, and he sits down with the mask down, then he's increasing the risk because the virus is in the air and he will inhale it. And this is a very important scenario in offices Or for example, Dr. Chaudhary will vouch for it that in the surgeries, where there's a change room for the doctors and other staff, which are usually not ventilated places, and we come and sit and relax there. So one doctor goes away and another doctor comes and sit in the same room. And if one of them is carrying the virus, unknowingly, it will be transmitted to the other people. And that is what's happening in the households now, particularly say in Delhi. We live in otherwise very polluted atmosphere. So we have got used to having our rooms literally closed and with the air conditioner on. And eventually what we are observing, that if one member of the family is infected, very soon the rest of the members are also getting infected. The reason being that first the person is unaware, and secondly, we are not opening our doors and windows to allow airflow and cross ventilation. So the virus remains for a longer time. So spreading from one person to the rest of the family members is a very common phenomenon we are seeing in densely crowded places, as well as say in our homes in Delhi, Mumbai, which have smaller homes and very close homes, and a lot of people are living together. So keeping the rooms ventilated, putting the mask even if you are at home and there is one patient even at home will help us break the chain. And finally, the third thing is like washing your hands repeatedly. And if you do not have facility to wash hands, at least sanitize with a 70% plus isopropyl alcohol sanitizer. So these, you have seen that in the first wave, we have been able to cut it down and keep the number of cases low by simply these three behavior. That time the vaccine was not there. Now we have additional advantage of having the vaccine. So only these four things can see us through with minimum damage to the community.
Absolutely. But sir, you talked about vaccines. Now, Dr. Chaudhary, it is said that the new variants are fitter viruses capable of breaking through increased host immunity. It adapts more, it could increase or decrease severity. But what would be the rate of transmission during the third wave, according to you?
Yeah, as you rightly said, the virus always try to evade the body immune system. So he wants to infect the person. So in any way, either it should cause more severe damage or it should cause more transmissibility. So you can see the second peak is very much rapidly spreading. That is high infectivity, and also to an extent is also more severe. The third is dependent upon the virus, how it is mutating and how it is behaving. So there is, you can say it is just a prediction. So it is without having any strong evidence. So still now they are telling that it is going to be more transmissible, may affect the younger generations more, but we should not go by that with a assumption right now. But I can say that it will have some behavioral change, and it may be highly infectious, highly transmissible, or less transmissible, but that will be known in the time. So at this moment, it is too premature to judge about the infectivity. It is only few reports are coming up, but we should not rely upon them. But my important at this point is that we should prevent the chain, as rightly suggested by sir, and what Dr. Sharma told, at the individual level, breaking the chain. And at the same time, we need a break in the chain at the community level. That means the restriction in the movements, then the, if possible, go for a lockdown. And however, we should also by ourselves should avoid having intermingling, group gatherings. All things should be avoided at a large scale in the community. So these are these behaviors will make this virus to be less mutable and less transmissible. Hopefully the third may be less severe. Hope for the best with a anticipation in a positive way.
All right, so you talked about lockdown, Dr. Chaudhary. Let me take that to Dr. Sharma. Dr. Sharma, there is growing chorus for imposition of a nationwide lockdown as the COVID wave has engulfed smaller cities as well. What is your take, sir?
Kriti, I beg to differ in my personal opinion on that. See, a complete lockdown is a last resort. Last resort in the sense that when you are not able to impose a self-discipline, and it was workable when the disease was confined to the large cities. Now we know that the disease has spread to the smaller cities into the rural areas. The comprehension about having a lockdown will put a lot of economic difficulties, social difficulties, and other challenges, which a part of it we saw in the first lockdown, the serious migration, the exodus. And here what will happen, that in rural areas or smaller towns, probably we don't have the adequate infrastructure to impose the lockdown in a stricter sense. So the purpose will not be served. We will not be able to achieve what we want to achieve by putting a lockdown of that kind. And the kind of disadvantages it will put to the micro communities in their day-to-day needs or day-to-day living, that probably will defy the lockdown in some of the places. I have that apprehension. Now, if our machinery, our government and our systems intensify their campaign about use of mask and about different other behavioral trends, and along with that maintaining some kind of discipline in the marketplaces. For example, we saw that in front of a grocery store in the first lockdown, we saw that there were rules that only a limited number of persons will enter into a grocery store at a given time depending on the size, and the other people will wait outside maintaining a distance. Now this thing had gone away after the wave 1 was over. In the month of February and March, we saw that the entire social distancing was like given up. Nobody was bothered about that, and that started or triggered the second wave. Here, if we continue to make those kind of strict discipline actions about when people are on the street or when they are traveling in public transport, reducing the number of seats, allowing few people to get transport at the same time, what will happen? That life will continue. People will not face hardship, and at the same time, we will be able to do that. So given a choice, I will go for a more disciplined approach, more intensive campaigns, rather than having a blanket lockdown over the country.
Dr. Chaudhary, you agree?
Yeah, definitely. But problem is our citizen and our civic sense. That is the biggest problem. If we thought that way, if it is a Western country, that is okay. But in India, it is very much difficult to follow the rule. Even we know that the traffic is for us. The traffic signals and helmet is for us. But we use this only because fear of the police. That is the difficulty in Indian population, and that is the 70% where the rural community or the educated, uncivilized groups are there. So that is very difficult, but definitely the way forward, that is what that we should go to lockdown. But only thing that when you get a big problems, you have to go to the last session. So I am also not in favor of a lockdown right now, but problem is that after even today per day we're getting 4 lakhs, but the same social gathering, the mask is hanging in the neck, no concept of social distancing is not there. So that is why this may be a support, but we need a bigger debate. Okay, so that can be justified subsequently.
Absolutely. But there's another important aspect to it, of course, of vaccination. Now, Dr. Sharma, vaccination will be needed to be updated to tackle the new strains that are spreading. And of course, as we talk of the third wave, do we need to upgrade our vaccines, and what do we do? Because, of course, we've already said that right now, vaccine nationalism is not the way, and we need to share technologies. So what's the way ahead?
Definitely, Kriti, this is the nature of the virus. It mutates. All viruses have this tendency to mutate. And the larger susceptible population they get, the more the number of people infected, more opportunities for the virus to mutate. Now, these mutations can be favorable toward the virus. It makes the virus robust. Or sometimes the mutations are also not favorable to the virus. Now, it's a dynamic process. So what we need to do, we continuously need to monitor. We need to do the genome sequencing, and we continuously need to see the efficacy of the existing vaccine against the newer mutations, right? And then if there are mutations which are jumping our immunity, who are skipping our immune system, then definitely the scientists have to go back to the lab and develop newer vaccines to tackle the newer strain of the virus. This is always a continuous dynamic process. And unfortunately, having a pandemic of such large magnitude covering the entire world, the possibilities of different strains arising in different countries is always there. It's an enormous task, it's an enormous challenge, and we have to live up to that. And in order to live up to that, we have to strengthen our technology, we have to strengthen ourselves in terms of skills, and at the same time, there's a demand for speeding everything, like bringing more expedited methods of doing it. So the challenge is huge. But so far, we have lived up to the challenge, and I'm extremely hopeful that we will be able to get newer vaccines against the newer strains also.
Let's hope for that, sir. But Dr. Chaudhary, according to you, how different will COVID-19's third wave be from the first two?
Yeah, that I also told before initially, because it all depends upon the virus behavior. We thought that if in the first wave it is doing cover the larger populations, then the second wave will be milder. But this not happened. First, we are not able to cover the vaccination large wide scale. The infection was the peak, or the doubling rate was relatively less, more. And what happened? That consequence has gone to second wave. So in second wave, we got a more transmissible virus with a high infectivity. So similarly, the third, the behavior will change. That is the crux at that point. If we are able to, Dr. Sharma rightly said that we have to cut down infection to the mass populations. More is the infections, the virus get the more chance for the mutations to evade the systems. If we are able to control now by all our methods, then it may be less severe varieties. So we are just skeptical, but whatever the scientific community is advising, the third may be less, but few are coming at, it will be more. So that is why it is totally confusing. We should not go into pre-judgmental decision that the third peak will be, or third wave, the virus will be more severe, more infectious, or it is going to affect the younger populations. It is only the assumption that the first is towards the elder age group. Now it is affecting the younger age group. So hopefully it may affect the more younger age group, child. So that is what is assumption. So this is a prediction which we should take now at a pinch of salt, I can say. And about the infectivity or the severity, we don't know, because it depends on the virus, how and which way it is mutating. If this mutation is going to favor this grow in a human being, or it is not going to be favored. If it is favored, then it may cause severe. If it is favored more, it may become a just mild and get asymptomatic. So that is very much different. So that we should not discuss much more, because it is only a assumption. It's not having evidences.
Even
Can I add something to
Dr. Sharma,
what Dr. Ashok said? There is an epidemiological perspective to it, which I want to bring in. That is, in the first wave, the most vulnerable population we found was above 60 years of age and people who had comorbidities. Two things happened. A lot of them got infected. It caused a lot of fatality in them. And the other group became cautious of their generation, and they started protecting themselves more. And even the family members started becoming more protective about the senior citizens at home. So what happened, that after the wave 1, when things opened up, it was the younger population, that means young adults in the age of 25 and 45 who were working, who had to go out for work. So they got exposed more. And that is the population which was more into like social mixing, partying, and like interacting and with a little bit of casualness about the COVID appropriate behavior. So the second wave affected them. Now, from the epidemiological angle of the total population, the most vulnerable got affected. The second most vulnerable got affected. They are getting vaccinated also. So these protective mechanisms are now gone. What happens now? The younger population who is exposed because they did not get the vaccine. Below 18 years, the vaccine we are not recommending so far because the trials are not out yet. And secondly, we at some point of time, if we open the schools and colleges, then this younger generation will be out and they will be mixing more. That is why we have this apprehension that the third wave may be hitting this population, because that becomes the vulnerable exposed population. Yes. So we have to keep in mind that if the third wave has to be stopped, we have to very judiciously think that how to protect this younger generation who is not yet vaccinated and who are at risk of being exposed if the schools and colleges are open.
So Dr. Sharma, what is your take on the process of clinical trials for vaccines for children specifically?
The trials are still going on. And very soon we are likely to get the results out, and maybe in a couple of months' time we have the verdict whether we can give this vaccine to children or not. In fact, in some of the countries, I was reading in the newspaper only that they have allowed vaccines 14 plus. So at least 4 years have already been covered in some of the countries. So I'm very hopeful that eventually the vaccine will be available for the younger generation also.
Okay, all right. As we move ahead, Dr. Chaudhary, how should we use artificial intelligence and machine learning, bringing in diagnostic solutions for COVID-19?
Yeah, thanks. AI is my passion area also. I'm working on it. So artificial intelligence has made the diagnosis of COVID first. I just want to highlight that the COVID is diagnosed in China by a blue dot. They have found that there is some suspicious CT scan findings are coming in a particular group of peoples in a particular place, and that led to diagnosis of atypical virus. Then comes the COVID. So similarly, for the diagnosis of COVID, AI is very much needed first to diagnose in a large scale. Suppose suppose now we are taking RT-PCR, taking 4 to 5 days. The AI is a model where it can take the parameters to diagnose with above 90% accuracy on a simple few parameters, maybe CT scan, maybe X-ray, or some clinical symptoms. So that is very much to go for the diagnosis. Another interesting is when you go for a diagnosis large scale. Suppose railway stations, big gatherings. So there is thermal cameras, infrared cameras, which can pick up your photos around 20 meters, 50 meters distance. They can take the sick behavior. So this person is looking something sick, he may be COVID, may not be there, but they can able to isolate this for the segregation. So that is how in large scale for the diagnosis it is helpful. Then second, you can say about the treatment part. So if you go for the treatments, few drugs also come up by this method. So they go for the virus dynamics and they find the drugs, how it acts. So when this artificial intelligence matches them, they find that this drug is going to be helpful. And from that, we are able to find few drugs also coming up. Then we go to most important is in public level is when you diagnose someone, we don't have any tracking mechanisms. What you tell is super spreaders. So now things has come up that you put some rings, some bands, or your mobile or watch. If they're AI enabled, so you can track these persons, where they are moving, where they're mingling. So that you can to put efficient monitoring system. That is a very good part to control. Also, we can use now also. I think few countries started this. So simply ring with the finger, it's sufficient. Your mobile, everyone is using mobile, everyone is using a smartwatch. So this way you can go monitoring and trackings. Then important is the misinformations. The social media, you can see get the trend. Now the COVID virus has spreaded, the COVID vaccine has gone up. So they can make a traffic flow different way so that they can able to curb the misinformation spreading. That is one. And second, sometimes you see that someone is uploading in systems, okay, this is I'm having a problem. And if the AI platform detect where these people are getting more information, so that can help to identify particular area of having this disease or no. So if artificial intelligence is really going into things, so that is first for the diagnosis. You can help in the part of monitoring these people's for the once get infected, tracking their systems. Third important is what I forget is a telemedicine system. When you are using telemedicine, there is a video platforms. You are taking clinical histories. From that also you can gather how these people are behaving, how you can diagnose them for the treatments. Then similarly for the research and part also for the drugs development, for the vaccine development, and what you are asked, which virus is going to be mutate how in the way. And another important thing is the treatment prediction. Suppose you are asking whether this patient is going to be improved with the treatments or no. So in having a data of around crores of peoples, we know a parameter by AI. These are the parameters. If it is there, the mortality or the outcome will be good. So this is way a lot of ways the artificial intelligence is going to be helping this COVID both in the outbreak, treatment, follow-up. So I encourage that we should include our technologies, AI enabled, to get help in COVID in all this sector.
All right, time for closing comments from both my guests. Dr. Sharma, how should India prepare itself for the third wave?
Yes, we need to improve our health infrastructure. Accessibility to the diagnostic and therapeutic services should now be available in a better way in smaller towns, in the remote and rural areas, because the disease has already reached there. Yes. Second, the referral systems have to be very strong for immediate transfer of the patient from the home to the appropriate level of care, whether it requires a primary level care or secondary level or tertiary level. That system should be very well developed. And as Dr. Ashok Chaudhary so nicely said, using artificial intelligence and the IT network for improving our data registration system. And one more thing I want to say, availability and access of scientific data about the patients, about treatment should be made available to the researchers on a real-time basis, so that our prediction systems are better. We can predict that now which particular part of the country is going to have a larger number of cases, or which is better controlling, creating a dashboard and making that dashboard available to everybody. This is very important and crucial thing, and an integrated approach. the clinicians, the public health scientists, the environmental engineers, the IT people, they have to sit together and make an integrated approach to fight the disease.
Dr. Chaudhary, your closing comments?
Yeah. So don't forget vaccines and don't forget the social vaccines. That is COVID appropriate behaviors. This should be your first protection and it should go universal. Second, I should say preparedness for the disaster. We should not face the situation what we are facing now. We need a strategy. So we should prepare for the next. And third, we need, as rightly said, every citizen is a part in breaking the chain. Let's everyone think that we can fight Corona, we can defeat Corona, so that no third wave. Hope for the best.
All right, so remember that every citizen is important in breaking this chain of the virus. On that note, thank you so much for joining us. Well, that's all we have for you in this edition of India Fights Back. But before that, let me remind you once again to stay safe from the coronavirus pandemic. Remember to wear a face mask and wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. These simple precautions are all it takes to defeat this pandemic. Take care and goodbye.